Hello, we are thankful to have you here for the interviews. Could you please tell us a few words about yourself, your role in your country delegation, and your background and focus in your practice?
My name is Agata Andrzejewska. I work in a first university hospital in Szczecin in Poland. I'm a specialist doctor of anesthesiology and intensive care, quite a specialist but still a young one. So in our hospital we have a trauma center, we have a neurosurgery, we have an intensive care unit, and we deal with a lot of trauma and TBI patients. So that's my background, and that's why I'm here interested in the neuroscience and neurotraumatology.
All right. So what motivates you to get involved in neurotrauma research and development?
As I told you before, we have a lot of patients in Poland, especially in my hospital, and I still feel like, and I think there's still a lot of place for improvement, and I think we can provide better care and to see the final outcome and help other people. Because there's a lot of patients very young, otherwise healthy, and I think there's a lot of place that we as a doctors, as a team, can help.
All right. Are you satisfied with the management of neurotrauma in your country and in your institution?
There's a lot of going on. I think there's always a place of improvement, every place. In my country, there's also, I think in my institution, it works quite well. Of course, as I told you, there's always a place for improvement, but we're getting better every day. Still, I think it should be more protocolized, that everybody is doing the same job, the same effort. Sometimes it's dependent of the quality of the duty, but I think we're doing quite a good job. But when it comes to our country, I think there are a lot of places for improvement, because as I told you, we're a university hospital, quite a big one, so always standards of care, I think they're sometimes higher. Maybe we have better possibilities, we have more funds, but in other places, we're not that aware how it looks, but sometimes when the patient comes to us, I think there's even more for place to do better.
All right. Could you highlight the main challenges in the treatment and research in neurotrauma in your country and institutions? Yes.
I think there's a lot to do at the beginning, so the pre-hospital care. So I think there's a lot of place how to deal with the patient to make it more standardized, how to assess how to choose the right place for treatment. So there's the short period of time before the treatment that's best for this patient. So he's not going from one hospital to another or staying at the emergency department waiting to be transferred.
Yes.
That's one. And the rehabilitation, I think we have in Poland, it's like non-existent almost when it comes to neurorehabilitation. When you have a private one, when you have funds, okay, we have a very few good places, but when it comes going back from the ICU or from neurology, it's not enough. And this patient, they require a lot of rehabilitation, and when we sometimes see the results when the patient went to the private facility, the results are spectacular, but when they're left behind, there's nothing left.
Yes. Next on, I would want to ask for your opinion regarding the TBI International Registry that we already discussed, and how do you think that this kind of registry could impact the management of neurotrauma on a larger scale?
If we want to improve, we have to have some data, because we have to know where we're at, what can we change, and when we don't have any data, we don't know what to do, how we can change. If the thing we're doing, is it making it better sometimes, or maybe it's getting worse? So I think it's very useful, and especially when we can compare data from different places, different centers, more experienced sometimes. We always should aim for the highest, the better facilities, and look how they're doing and compare our data. So when we have a registry, we can know what we're doing and how it affects our patients.
All right. So what are, in your opinion, the most important quality indicators for neurotrauma care?
Quality indicators, so we should aim for this patient not if he only survives or not, but the quality of life and how he feels, if he's going to be able to go back to the society, if there's any signs of depression, or if he can be independent, because that's the most important. Because if we have a high survival rate, but the patient is totally dependent on others or spending the whole day at home, that's not a success. You want to get them back to the regular, as possible as normal life.
So the quality of life
Quality
indicators
of life, I think it's very
be-
important, and the independence.
All right. As we discussed, a multidisciplinary team is a vital asset in TBI management. But what do you think are the specialists that should be involved, and why do you think that these certain ones are the most appropriate?
I think it should start from the very beginning. So, as I told you, the pre-hospital care. So, even this dispositories that tell which patient where to go, how to assess him, how to stabilize him, how to get him the faster to the right hospital, so that that he won't have to wait or to be transferred to the other facility. Then the emergency department, because there's a lot of, as everybody knows, there's the golden hour when it comes to TBI. So emergency department, they have him at the beginning. So they should assess the patient and call the neurologist or the intensive care specialist, depending how bad the situation is. So there's a lot of doctors. So emergency, the paramedics, neurologists, intensive care and anesthesiologists, and neurosurgeons. And at the end, as I told you, rehabilitation. So they all together should work and find the best possible way. And what's the most important, they should communicate, because I think sometimes it's lacking, the communication.
Yes, that is actually on point with my next question, which would be, which are the main obstacles in terms of collaboration in a multidisciplinary team?
Work overload, that's one of the things, because everybody has not only the consultation, the TPI patient, but everybody has a lot of going on the wards. So I feel we're lacking doctors, nurses, so everybody is overloaded, so sometimes we become impatient when we have to do something extra. But when we focus on the good case, it's going to be helpful. There's a lot of individualists as a doctor, so you won't tell me what to do. But if you work on our communication skill, that nobody tries to be superior, but we should work together. So I think like the briefing and communicating and working together on our skills, and keeping in mind that we're here together for the same reason. Nobody tried to compete or anything like this, or just to push the patient from one side to the other, like we're talking the hot potato. Nobody wants it. Everybody wants to, to work together. I think that's one of the most important things. And very lacking, I think we don't have enough training when it comes to communication skills.
All right.
So I think that's one of the important job to do.
That is a very good point that you've made. How do you feel that an online community for those interested in neurotrauma could impact research and medical practice?
I think it can be very useful. Because of the online of the facilities, the world became smaller. It's very useful in medicine that you can call somebody or write to somebody on the other part of the world and ask him, okay, what's your experience? I haven't had that much cases. Maybe you've done them better. Maybe I can learn from you. So it's always good to compare what you're doing. Maybe somebody does it better. Maybe they have different ideas. Because it's usually, when you work at one place, you're focused, you was doing something all the time the same. Maybe you should see someone and talk to someone to think out of the box. Maybe something else that you just skipped your mind, and he thinks about it. So I think it's very useful when you have an online community or some apps or anything like this that is going to help you to share the experience. It's very, very useful in my opinion.
All right. And what do you consider to be the main challenges in the prevention of neurotrauma?
I don't think we're going to prevent it, but it's all about education, and once again education. As we were talking, sometimes you see people without helmets, telling them, and not telling that they're going to die, because dying is easy. I'm sorry for saying this. It's going to be a tragedy for your family. But when you die, everything stops. But being like unable to do a lot of stuff, losing your life as you had it before, showing that you can suffer a lot of pain, and tell them, okay, protect your brain, it's so important. So it goes to, because what we do as doctors, we have a secondary brain injury, but the primary brain injury, that's what goes to people. So talking about safety, about the precautions, and keeping that in mind.
All right. What do you believe was the impact of COVID-19 on neurotrauma management or the caseloads? Has it changed in any way?
In my center, the caseload was enormous, because we were the last hospital that was closed because of COVID. We had the workload was, I don't know, it was terrifying sometimes, because we had also COVID patients and all of the rest, because other hospitals there were only COVID patients, and we had everything: COVID, trauma, strokes, neurosurgery, and everything was coming to our hospital. And we couldn't take a good care because we were tired. So we sometimes skipped something out of our mind. Sometimes the patient had to wait for urgent surgery because the other one was already taken place. So it was a lot of place for mistakes, unfortunately, and not the best care that we could provide. So I think a lot of patients suffered because of the poorer hospital care, unfortunately.
All right. And the last question of the interview is regarding the AMN organization and whether you are familiar with the organization or have you participated in any of our past events?
No, it's first time I'm here. One of my colleagues, unfortunately, she couldn't be here, but she's really into research, and especially when it comes to neurotrauma. She knows the organization. She told me something, and she helped me to come also in here. So I'm really looking forward to knowing it better and knowing about the research, but I'm for the first time in here and really glad that I'm here and looking forward to what's going to be next.
I hope you like it, and I hope you will come to our next event. Thank you very much for your answers.